time.
Hello, everyone, and welcome back to Tuesday Tips. I'm Dr. Vidal, and we're here at Pure Plastic Surgery with our weekly check-in. We go over different topics in plastic surgery, and I get to answer your questions. Today, we're going to be talking about the common fears after a tummy tuck. This is the most common things that people are like, I don't want a tummy tuck because of this and that. So we will go over what are those things, what can we do to minimize those, and I tell all my patients, I haven't had one patient after a tummy tuck that regrets their decision of having the tummy tuck. Why? Because they take care of their scars, the belly button heals and everything, and the contouring is a lot better. If you really need a tummy tuck, it's a lot better than with just lipo, okay? So let's go over what are the common fears. The number one, top of the list, is the scar. I don't want the scar. But the reality is, if you have an apron or loose skin that folds in your belly, most of the time you're not wearing the things you want to wear. And if you have the scar can be easily hidden in a bikini, okay? So where do we put this scar? So the scar for a regular tummy tuck goes from hip bone to hip bone. So if you palpate here your little bones, the anterior part, not the lateral part, the anterior part, when you're laying down, you have those little bones that stick out. So basically from there to there, okay? Even if it's a mini tummy tuck, the scar length is usually more or less that, maybe a little shorter, but most of the time that. Why? Because that's the length that covers the anterior abdominal wall. If I just tighten here in the center, you'll see a change basically in this small triangle, but not the entire abdominal wall. So the abdominal wall goes from those little anatomical points that fix the abdominal wall there. So you're gonna see a better result with the scar from there to there. But where to put it? Very, very low. So at the end, it's like a curve like this, okay? It's not straight, it's not raised up here, it's very low. So you easily hide it in a bikini, okay? So if you, even a very low bikini, you can hide the scar. Why is it important to do it very, very low, especially in the center? Because it lifts the pelvic area, or the fupa, like some people call it, that excess skin and fat that accumulates in the pelvic area. When you do the incision of the tummy tuck very low, that lifts that area and flattens that. Sometimes I do some liposuction there if it's very fatty, or sometimes I do excision of the fat directly when I'm doing the tummy tuck to flatten that area, but it is an area that is going to improve after the tummy tuck. What other area is so important after the tummy tuck? The belly button. And this is an area of concern for everyone that needs a tummy tuck. So what are the things that we do to minimize scarring in the belly button and reconstruct it in a way that is not a visible or such a visible scar? I do a couple of things to try to get this belly button to heal nicely. The first one is I use your belly button. I don't think that rebuilding or redoing the belly button gives a better scar. Remember, our belly button is a scar, okay? It's the umbilical cord scar that forms after we're born. So if we keep that stalk, basically that shape of belly button like a cone, then that is going to give you the best result. If we try to make that cone, it's never really a cone afterwards, and it flattens. I see a lot of patients that had what's called a neo-umbilicus, or a surgeon reconstructed the belly button from scratch, and it usually flattens. It's very hard to achieve that cone shape with suturing. So that's why I keep that cone. But what do I do with the cone to try to get it to heal better? So I don't leave it as long as it normally is. So with pregnancies, with weight fluctuations, our abdominal wall distends, and basically the belly button stack or that cone becomes longer. So one of the things that I do is shorten that to make it that the scar heals on the inside by pulling it. I also put some stitches on the inside to tag it down to the fascia or the layer of the muscle to kind of bring that scar in. And after all of this, I'm going to ask you to use a belly button shaper 2 weeks after surgery. What's a belly button shaper? It's basically like a marble, a little silicone ball. They come in plugs as well. I don't love the plugs, but the little balls are better. And basically you put it on the belly button to avoid the scar to contracting too much, that it closes down, okay? And that is the best way to try to achieve a natural belly button. The other thing that I do with the stitching on the inside is try to create a little bit of hooding or fold in the upper part so it looks more natural, okay? So we got rid of that belly button stigma of that like scar around it that it's very visible. The lower scar is very low that you can hide it easily on a bikini. So we're taking care of those two things. The other one that people are so afraid of is the dog ears. What is a dog ear? Dog ear is excess skin that accumulates in the corners of the incision. Who is at an increased risk of this? People that have a fold that extends laterally, or people that have laxity all the way to the buttock and would benefit from a circumferential body lift that kind of lifts that pelvic or buttock area up, okay? So those people are more increased risk, okay? I try to do my best, but remember that the tummy tuck, you're laying on your back, so there is so much out I can go to kind of reset that and try to avoid a dog ear. And the other reason why you can see it is because I do a fair amount of liposuction in the waist area to accentuate the waist. And when I empty all this area up, this skin will need to retract, and sometimes because the scar is at that position, all of this retracts very well and you see a little bulge in that area. I know no one wants a dog ear. I try to avoid it and I try to restitch it after the end to try to prevent it and try to get it as flat as possible. But the good part is, and I tell my patients this, is it's a very easy fixable thing. We fix it with local anesthesia, just like the dentist. You come in here in the office one day, excise it. We just put some numbing medication, excise it, close it, and that's it. So if you do start to see a dog ear, don't freak out. It's something that we can fix very easily in the clinic under local anesthesia, okay? Spitting sutures is the other thing that people freak out about. What's a spitting suture? So basically, all the sutures that I put in my tummy tucks are absorbable on the inside. You're not going to see any stitching on the outside. The only two that you're going to have is the one attaching the drains. So I put drains inside, and that's the next pointer there. But let's focus on the spitting sutures now. So because all of the sutures are absorbable on the inside, it's good because you're not going to be able to cut or you don't see any stitches on the outside. But sometimes the body tends to kind of spit out or kind of expose those sutures when you're healing. That tends to occur about 2 to 6 weeks after surgery. It can happen up to 6 months after surgery. How would you see it? It looks like a pimple. So basically in the scar, you start to see like a little pimple head or a little red area. You touch it, you may actually feel the stitch. If you feel this, don't get scared. You just clean it with alcohol. Once you feel the little stitch, you can actually pull it and it'll heal like a pimple. Basically, at first it'll be a little open. You can put an antibiotic ointment in it and then it heals on its own. You're not going to unravel anything of the scars. Some people think that if I pull this, then all the wound is going to open up. No, the stitches are very individual. So it's basically like a tiny thing. When you pull it, it's just right there. I put a lot of suturing because with less tension, better the scar and more like a line it is. So that's why there's so many stitches on the inside to decrease tension on the wound healing, okay? So again, if you see it, very easily fixed. So don't be scared and just pull it and it'll be completely gone, okay? And drains. Nobody likes drains, but I think they're so helpful. Drains are our friends, okay? If we have fluid buildup, that's called a seroma, then I'm gonna have to be sticking you with a needle aspirating fluid, and the results can be affected with swelling and swelling that doesn't kind of resolve, multiple aspirations, sometimes even need to take you back to the operating room for what it's called a cavity or the coverage of that seroma excision. So trying to avoid seromas and having that fluid kind of drain without the need for it sticking you, or whenever I'm sticking you, increases risk of infection because I may be putting a bacteria from the skin in. So that is kind of erased or removed with the use of drainage, okay? So drains are little plastic tubes that you'll wake up with. It'll be with you for 2 to 3 weeks, sometimes up to 4, depending on how much is draining, and then you'll never see them again, and it'll decrease the risk of having those problems. The massages are actually more easy for you because it's just like massaging that fluid towards the drain, and that initial fluid, it gets recovered, okay? I know they're not the most comfortable, but they're so helpful, and then the headaches are a lot less, okay? So I use them in tummy tucks, I use them in liposuction. Liposuction is only for 5 days, so it's only for that initial week when there's a lot of fluid buildup. I don't use them for breasts, I don't use them for arms, okay, so brachioplasty, but I do use them for tummy tucks because the area that I have to undermine or resect for the tummy tuck is bigger, so the risk of developing seroma or fluid buildup in the area is bigger, okay? I'll take some questions now.
There are a lot.
A lot of questions. Bring them.
Yes. Those and extend arm leaves remove all of your armpit hair.
Not necessarily. So with the armpit, an extended arm lift is basically you have the breast, and then the breast scar goes like this, and then it connects towards the axilla and towards the elbow. Basically getting rid in the lateral chest of this broad roll of skin that some massive weight loss patients develop that is very loose there. So the arm lift, then it excises some skin in the hair-bearing area or the axilla, but I'm not very aggressive with the excision there because then you may end up with tension in the scar, which causes restriction and of range of motion of the shoulder.
How common are thigh lifts? How many does Pure perform a year?
Don't have that number. I do perform a fair amount, but it is the least common procedure because that is not here nationwide. You can look the statistics for the body contouring procedures nationwide, and thigh lifts is one of the least common procedures to get. The reason for it is the recovery is a little harder, and the scarring it's a little harder to heal because of the position. I did a thigh lift Tuesday tips recently, and I go into details about the scarring placement, how to avoid wound healing problems, the usage of drainage and massages afterwards, which I think are very beneficial. But yes, I mean, I do them a fair amount, but I don't have a number, but the reality is I do other procedures more commonly because thigh lifts is just not as a common procedure.
I had a tummy talk with you, Dr. Vidal, in February of this year. How soon can I get a lipo on my back and arms? And can it get done at the same time? Back and arms?
Yes, we can do both of those at the same time. February, March, April, May, you're good. I recommend at least 3 to 4 months between the procedures, so you're good to schedule the procedure. And yes, you can combine lipo to back with arms.
Is it possible to do a breast lift without implants?
Yes, very possible. Difference with breast lift with or without implants is without implants, you are going to be at least 1 cup size smaller, okay? Everything, it's going to be tight enough, so even if I keep all the breast tissue present, it's going to look at least 1 cup size smaller. And the other thing, the shape of the breast is going to take a natural breast shape, which is more like a teardrop. If you're looking to keep or increase your volume, or keep a very round, perky, full volume in the upper part of the breast, then you need an implant for that.
Can you do upper body lift at the same time as a brachioplasty?
Yes, I've done that. It is a combination that can be performed. The upper back lift is the bra line lift. Basically, if you have upper back rolls, basically an incision at the bra line level, and then the brachioplasty procedure. Yeah.
Okay, the incisions vary depending on the patient.
Correct. Yes. Everybody's anatomy and shape and folds and skin is different. So the incisions vary some. The concepts are the same on everyone. For example, for a regular tummy tuck from hip bone to hip bone, an extended goes all the way to the sides, past that the bone in the anterior part. A circumferential goes all around to the back. So the concept is the same, but the scars are going to be a little different depending on the level of the folds that you have, your skin quality, the shaping and your bony structure underneath, and also your healing.
A patient that's having a procedure with you in a few weeks, she missed out the part of the dog ears and worried about that because she's having an upcoming tummy tuck.
Yeah, I know. That's why I wanted to go over the common fears. Don't worry about it. It is something that I try to avoid it as much as possible, but if we do have it, very, very easily fixable.
Okay, I'm scheduled with you, Dr. Vidal, for August. Lipo 360 and face tight to the chin. You states that use drains for liposuction procedure. Does you remove them at the facility?
Yes, for liposuction, I remove them on post-op day 5 when you come for the follow-up appointment on all the liposuction patients. For tummy tucks, it depends. It depends on the output. So tummy tuck drains will be kept in place until they're less than 25 cc's in a 24-hour period, okay? So how much? 2 to 3 weeks, okay? Most of the time, the left drain, the one on the left, I put it on the inside going up, and the right goes down. So the left is usually the one that we remove first. Sometimes I can remove this on post-op day 5, but it depends on this drainage, okay? So the day before your 5-day appointment, empty it on post-op day 4 at 24 hours before your appointment. So if your appointment is 9 in the morning on post-op day 5, 9 in the morning, post-op day 4, you empty them. And keep it like that. If it's full at the end of the day, empty it because we're not going to remove them. But if they're not full, keep it like that until we see you. And then we check this, and if it is, we can remove at least one, okay?
¿Se puede hacer un tummy con reducción, levantamiento y cambio de implantes?
Reducción, levantamiento y cambio de implantes, seguro que sí, podemos hacer eso. Eso es lo que llamamos el mommy makeover, que es la combinación de senos con el tummy tuck. Y en senos puede ser cualquier combinación dependiendo de lo que la paciente necesita. Se puede hacer una reducción con cambio de implantes, levantamiento o cualquier cosita que la paciente necesite.
Ok. Un segundo. Please address how muscle plication works. Do the muscles fuse? GRW. Okay, I don't understand that, but
Okay, let's go over muscle plication.
yes.
So, to understand muscle plication, we have to understand what a diastasis is. So, if we have, this is the abdominal wall, this is the umbilicus. We have the rectus abdominis muscles here in the center, or the six-pack muscle, right? So when we have these muscles, they're in the center, that helps flatten and stabilize our core. With pregnancy, weight gain, anything that increases the intra-abdominal contents, and you have stretching of the abdominal wall, what happens is these muscles go to the side as the belly extends, and this separates in the center. And it's not a hernia because it's not a hole, it's not a defect in the wall, but it's a stretching effect, basically, of the muscles. So you have basically this stretched out, so one muscle is here and the other one here, right? Six-pack muscles. So now you have a bulging, your abdominal wall has no support, so you're not able to see a flat belly even if you lose weight because the muscles are stretched apart. So you have one muscle here, stretched in the middle, okay? It's not a hole, it's not a hernia, it's a stretching, okay? So what do we do to that. I basically elevate the skin from the muscle all the way to your xiphoid or chest bone here and down where your pubic bone is, which is where the muscles connect here in the bottom and here in the up. And basically I use a suture to bring one muscle edge to the other. And I actually go a little past that to give you that silhouette like a corset. So basically from here to here, here to here, here to here, and basically like this. And the effect is it kind of folds everything in. I don't cut your muscles, I don't open your abdominal wall. It's kind of folding everything in and creating this effect at the end, like a corset in the middle. That's why your waist is going to be smaller and your belly flatter. Okay, awesome guys. So thank you so much for all your questions. And I have a special announcement to do. This beautiful beach purse is going to be a giveaway for 10 prior patients that send us, the first 10 patients that send us your before and after in the beach or pools or bathing suit, you'll get one of these in the mail. So if you want one of these beautiful beach bags, then send us your pictures and we'll be sending it to you, okay? And I have one, so I'll be using it this weekend. Long weekend coming up. So thank you so much for joining. I'll see you guys next Tuesday in Tuesday Tips. Thank you so much for your questions. Please drop any recommendations of topics you want me to talk about next week, and hope everyone enjoys their Memorial Day weekend safely, okay? Take care.